I'm Dr. Jocelyn Levesque, and I'm a plastic surgeon. I have a private practice in plastic surgery, so I spend half of my time seeing patients in the office and then half of my time doing surgery in the operating room. As a plastic surgeon, I do cosmetic surgery. I also do reconstructive surgery. Some of the common surgeries that I do would be breast augmentation, liposuction, tummy tucks, facelifts, eyelid lifts, breast reconstruction after patients have had breast cancer. So I typically spend, like I said, about 2 days in the office seeing patients. So I would see them for their initial consult when they come in to try to tell me what they want to have done, and we talk about what that would entail. Then I also will see post-op patients after they've had their surgery, making sure that everything has gone well, and I'll usually follow them for at least 6 weeks after surgery. And also we see them for pre-ops because they'll come in for a visit 2 weeks before their surgery where we can go over everything with them, their pre-op and post-op care, as well as give them prescriptions and take pictures. So that would be how my day goes in the office. As far as in the OR, I'm typically going to operate between 7:30 in the morning and 5:30 in the afternoon. So it'll just depend on the length of my cases as to how many cases I do a day. It could be 5 or it could be 2, depending on whether they're combination cases that would take longer. But it's usually a full day of operating on the other days of the week. I do tend to take call about 10 nights a month for the emergency room, in which I would have to go in to take care of complex lacerations. That's mostly what I get called in for these days because I have tailored my practice now after 20 years of maybe not taking a lot of the major facial fracture call or things like that. My practice also, because I am in private practice, it is like running a business. So I do have to do employee management, worry about expenses, what we're taking in, what we're paying out. We do a lot of advertising, and all of those things we approve and organize, and so it is just like running a business. As far as how much stress do I feel with my job? Well, obviously we have people's lives in our hands. Fortunately, in plastic surgery, we don't worry too much about that aspect of it. If we did have a patient that didn't do well, that would probably be unusual. But we do have to manage people's expectations. So it is very stressful sometimes dealing with people and having unrealistic expectations. And so that can be very stressful, just dealing with the patient in the office who may have gotten a great result, but maybe they don't think they did. So there is stress level, obviously, with dealing with patients. Also, there's some stress with working long hours. But overall, when we compare it to probably other physician jobs, it's a much lower stress level. So after high school, of course, you would get a college degree. My degree actually was in psychology, and I actually do feel like it does help me with my particular set of patients in dealing with their expectations. And I actually suggest when you go to college is do get a major that interests you more. To get into medical school, you do have to get certain pre-med requirements out of the way, but you do not have to get more than that. And I think it also makes you a more well-rounded person, and also may make you stand out to the medical school people that are interviewing you, because you look different than the average patient or average student who got the biology degree. So I would definitely do that. After college, then you will go to, if you get into medical school, you go to medical school, and it's 4 years also. The first 2 years is basically classroom work. You're going to be doing gross anatomy, biochemistry, neuroanatomy, embryology. So it's very much classwork, some lab work, but not necessarily hospital experience in dealing with patients. The second 2 years is actually rotations into where you are going to be under other physicians in the hospital, rounding on patients, helping in surgery. Your fourth year is usually made up of a little bit more specialized hospital things, and you can kind of focus maybe on some of the interests that you have. For example, you could go away and do a few externships in an area you're interested in. If you're interested in general surgery, you could go do that. You could do ER medicine. You do more specialized types, rotations during the 4th year. And then you take your boards in the 4th year for you actually take your first level of boards after your 2nd year, and then you take the next level after your 4th year. There's actually 3 sets of boards you take throughout medical school in order to actually get your MD. And so residencies would be in the area that you want to practice medicine for the rest of your life. These days there is actually plastic surgery residencies, and it is a 6-year residency. So basically, we've just said you did 4 years of college, you do 4 years of medical school, and then you would do 6 years of plastic surgery training. And it's a lot of general surgery along with plastic surgery. There are probably a few other skills that could help you with plastic surgery. For one, I was always very interested in art, so I like to paint and sculpt, and that's very, very helpful when we're dealing with cosmetic aspects of what I do. It really helps me to get better results by understanding that type of aesthetic experience. And I think the other thing that's very important is interpersonal skills. And you really have to have a lot of compassion and patience for the types of patients that we see, and having very good interpersonal skills, because our patients they're paying, a lot of them are paying cash out of pocket, and they have the ability to search around for various doctors. Some of them will go see several different doctors in consultation before they decide who they want. So that's very important, to be able to know how to deal with patients. For one thing, I really like fixing things. Unlike some areas of medicine where you're just sort of making things better but not really fixing it, just people with medical problems that you're just trying to improve but can't solve. But with what we do, we're taking a problem, we're fixing it, and we're done. And I feel like plastic surgery patients, a lot of them are extremely happy with their results. They come in with maybe feeling low self-esteem, not liking the way they look, but feeling, just not good about themselves. And in the end, when they walk out with so much more confidence and feeling good and the problem's fixed, that is the best part of my job. One of the other reasons that I chose this job was because of the lifestyle. It is a very good lifestyle. I really don't, while I am on call 10 nights a month, I hardly ever get called into the hospital. So I pretty much can set my schedule the way I want it. I don't have very many emergencies. I have a family with 2 children, and it really has worked well in regards to being able to be there for my kids as they were growing up. As far as the worst part of the job, unfortunately, it probably is managing patients' expectations. When we are dealing with cosmetic issues of patients, we do sometimes, and not every time, but we get personalities that sometimes just are never going to be happy. And we can do the best we can and make great results, and we may still have people that are even despondent about the results they have, even though anyone else that would look at it would say they were great. So there can be people who have a little bit of some type of psychiatric issues that are coming to get the surgery, and managing that is the most difficult thing I have to do. So my final advice is, I think that what would scare people off the most about this career is the length of time that it takes to get to the end result. And what I would have to say to that is, I never felt like I was a short-sighted person. And that's why I say, don't let it scare you, but you do need to think about that. I went straight through school, from high school all the way through, and I was done when I was 33. And some people may think, oh my God, that's terrible that you're not even done with your training until you're 33. But the way I look at it is, I'm going to be doing whatever I'm doing for the rest of my life. So what's wrong with taking a little bit longer to get to the job that I'm going to want to do for the rest of my life, as opposed to stopping my education maybe a few years earlier because I'm scared of that, and then for the rest of my life I'm doing a job that I really don't want to do. Like I said, it's a great job. I have fun doing it. I have a great lifestyle. It affords me a good income. So the one thing I have to say, you do have to seriously consider whether you do want to do this training for this long, but don't be scared of it.